in our country, which is very much needed. And because you all know about 65 doctors, lady doctors, 65, 35, about this is the ratio in our medical colleges. I hope in future urology will be developed in such a way that the lady will also come, as because there are a lot of complications among the lady urology patients. As because Priya has already told, and I have heard something from her, this is very much alarming. We are needed of. In our department, the faculty, they are performing a lot of activities, and you will be happy to know that during my tenure, after passing, everyone should learn much more, as because there should be hands-on training. So in our university, we have made fellowship program, 1 year fellowship program, and it will be started from the next session, and I hope on uro-oncology, pediatric urology, and also in transplant, renal transplant surgery. In this case, we have given 3 fellowships, and this is much more in urology department. I have given in other departments, but in urology, it is about 3. So I hope the future surgeons or urologists will be able to perform their duties very nicely by performing this fellowship program. I will be very much thankful to these 3 people who has given their time for these lessons for 2 days in our country. This dissemination of knowledge is very much needed of, and you all know that after passing, if we don't disseminate, we cannot find our performance perfectly. So this type of lesson should be continued. Last year, this program was in Shohid Dr. Milon Hall, and this time it is in the super specialized hospital. You all know, last year, our Honorable Prime Minister, she has inaugurated this hospital. It has already started its OPD as well as indoor program. We are very happy that last year when this program was there, but we had not any history. Now we have some history. One is that you all know about 52 years we have been liberated. We have been, our independence is about 52 years. But there is no cadaveric transplant in the country. And I am very happy that our urology department, they have made this history after 25 years of establishment of this university. We have made cadaveric transplant, and Professor Khurshid, Professor Depu, Professor Habibur Rahman, and Professor Farooq, Dr. Farooq, all were the team member for this recipient and donor in cadaveric, and also the receipt 2 kidney was given to 2 patients, and 2 cornea was given to 2 patients. So 4 patients we have performed this type of operation, which is the new one. And the patients, they were very good after surgery. And another liver transplant, which is successfully made in our country, and the sister has given the liver to her brother, and both of them are still in good condition. You see, this super specialized hospital, this has also another record. During this morning day on 15th August, we have 1 renal transplant in this hospital, even though on that day there was holiday. But we performed this for the respect of our father of the nation. Again, 1 pediatric kidney transplant was performed in this hospital. The mother has given the kidney to her daughter. Both of them are now all right. It is already in the social media, you have seen. So I think this type of ERCP or stroke center, cardiac intervention, more than 50, it is going on. All types of latest. There are 5 centers, you know, in this super specialized hospital. Children and mother and children, 1 center. One is the nephrology and urology. Another one is the hepatology and hepatobiliary. Another one is the stroke, cardiac and neurostroke, and there is the emergency. So this specialized hospital, I hope this will be in such a way that the dream of our Prime Minister is that no patient should go abroad. We have a simple calculation that if anyone goes abroad for kidney transplant, they are to spend about 40 lakh. How much dollar it will be by 100, you can make it. And also, there is the, only in this hospital it is about 3 lakh. So about 37 lakh for kidney transplant we can save. Again, in liver transplant, it is about 1 crore in other countries. But in our country, we have made this liver transplant by 20 lakh. So about 80 lakh would be saved. So we hope if all the patients in future, I am looking for the future urologist, transplant surgeon, you should come up that lot of patients are waiting for you for surgery, training, as well as surgical skills should be developed by you. That will be helpful for the country and no patient will go out. You all know that during the corona, our Honorable Prime Minister, she managed very nicely and she was in such situation in Southeast Asia. Bangladesh was first in corona management and in whole world it was, her position was fifth. So I hope in future all the treatments during corona, no patient was allowed to go abroad. All the treatment was given by our specialists. So we hope all the specialists of this country are competent enough at per international level. So I hope all the treatment will be given in future and all the patients will be treated in our country, not abroad. And lastly, I will tell one thing, that the urologist, the number of urologists should be increased. How we can proceed? In burden, if there is faculty, if they apply, we can give this course. In this way, different institute where there is the faculty members, we can increase the numbers. And that will be helpful that by next 10 years, how much manpower in urology is needed, we can make it with the help of all the faculties of our country. I think I will not take much more time. I will be always with the doctors of this country, as I was the ex-Secretary General of BMA, and in our university, I am grateful to urologists, as because they have made the history. They have made my university in such a way that in the country it is ever remembered for cadaveric and this type of transplant every day. So I hope they will be with me, I will be with you. With these few words, thank you very much. Thanks to our foreign faculties and all the faculties who have they have delivered their speech here, and I have given the token of love by giving crest. I hope the persons who are attending here, your presence made this program a successful one. With these few words, thank you very much. Joy Bangla, Joy Bangabandhu, long live Bangladesh.